Mental Health Monday on Radio City Talk with Mick Coyle.
Radio City Talk.
I wanted to bring you this interview because it brings about some great organisations doing brilliant work that could really make a difference to people's lives. A new text service which is being launched through James's Place, which is a centre based here in Liverpool, which aims at preventing suicide, particularly suicide in young men. They've got a new service which is up and running. Jane Boland joined me in the studio from James's Place to explain what the text service is and how they're working in partnership to bring this to people right across the country. This could genuinely save lives, and Jane Boland explained why.
We're very excited today. We're working in partnership with an organisation called Crisis Text Line, and we're doing what's called white labelling. You know, when you go to Aldi and you buy beans, but they're actually Heinz beans, but they've got the Aldi label on. So they have very generously given us the opportunity to take advantage of their crisis text messenger service. So for people in Liverpool, it's you know, they will be able to text JP to the number 85258, and then that will put them in touch with via text with sort of trained volunteer counsellors who will take them from kind of a moment of crisis or a feeling of crisis to a feeling of calm.
So, and we got, by the way, Aldi and Heinz, that was just an example.
That was just an example of white labelling. Don't send anything.
Don't send your lawyers in my direction. But in regard to that, James's Place is becoming associated, isn't it, with the great work that you're doing, preventing male suicide and having those incredible interventions as well. The fact that James's Place's name is on it is an important thing, isn't it?
Well, it's important for both organisations. You know, the fact that the crisis text messenger service trusts us enough to use our name as their label for people in Liverpool. So you know, that's kind of an endorsement by a larger organisation of a smaller organisation. And for us as a smaller organisation, it would have been impossible for us to provide this kind of 24-hour support. It would cost more than it costs to run our service. You know, so being able to sort of tap into a resource that's already there, but make it sort of feel personal to the people of, you know, to people in our area, that it's also associated with James's Place, so they know that we trust it and think it's a good service as well.
And that's testament to the reputation that you built, Claire Milford Haven, and people like that in building the service and the name James's Place. Can I ask you about the free messenger service? This is available if you text JP to 85258. It's a 24-hour service. So what how does it work, if you like?
So it's a free service. I think the only sort of small hiccup is if you're on a Samsung headset and it might come up saying, oh, it's not free, but in fact it is. So with all sort of networks, it's free. So you would text that number and very quickly a trained counsellor will get back to you and would open that conversation up with you. They have been trained in sort of de-escalation, supportive listening techniques via text. They've gone through a really rigorous training program. I've sort of been able to have a look at the training program and you know, it's excellent. They are also supported by trained clinicians, so it's all very high tech, and that it's run off a platform where when you text in, you will end up talking to somebody. They will be on a laptop, you will be texting, but they'll be texting back to you, and they pick you up as sort of a client. But it's and then they will respond to you by text. So people, there'll be volunteers, students, people like me who might volunteer, people like you, anybody, and you will be talking to somebody who is there just to spend time with you and talk you through that crisis.
We've spoken before about points of intervention and the point at which you're able to sort of intervene in a situation of someone with suicidal thoughts. We've also talked about James's Place itself and how you've created an environment. Obviously, though, from the work you've done, you've seen value in this sort of technological solution. It's a different type of intervention that might come at a slightly different time.
Yeah, so I think this would come, I mean, what we've always identified with James's Place is that it's not, although we're talking to people who are in a crisis, we're not a crisis intervention in that we don't have people just turn up on our door in a crisis, distress state. We do get people who come and see us who are quite distressed, but there's something about that. There's almost a gap between that person contacting us and coming to see us, and it can just be a couple of hours, but there is that a person has made almost a decision that we're the right place to help them and they're coming for help. Whereas this intervention is when you don't know what to do and when you don't know who to turn to. And you know, especially I think for young people, which I'm not one of, a lot of their communication with each other is via text. So having it in a sort of a way that they are already used to communicating with each other is quite helpful, I think.
You can text JP to 85258 and this service through James's Place launches today.
Yeah.
Someone, a trained volunteer, will respond in less than 5 minutes. That's the plan.
As promptly as possible.
And we talk about intervention times. There'll be people who have told me horror stories about waiting to speak to somebody, anybody.
And that is why, as you know, the aim will be that by this time next year, this will be a sort of a national service. So we're one of a number of smaller organisations that are rolling it out locally, so that they know that they can make sure that people aren't waiting for hours for people to get back to them. So they will get back to you as quickly as possible via text, and will take you through that crisis sort of situation too. They talk. It's really interesting, the training. They talk about taking you from hot to cold or hot to cool. But they will also, sort of make sure that you know, that they have an understanding of the other resources that are available. So this isn't just for people who are already using James's Place, and it's not just for men, which James's Place is. This is for anybody that they can sort of access this crisis messenger service.
So it's up and about from today. A crisis text messenger service. You can use it today. Text JP to 85258. I guess as well from the sort of the crisis text line service, if they see that the JP version of that is being used a lot, they'll see the value in working alongside you, which obviously gives James's Place a little bit more in terms of its reputation, its growing reputation, as well as using best practice.
And I think it's about ways of working differently with other organisations. I mean, I think it's the opposite of being competitive with other charities and other mental health organisations. It's taking our very particular sort of niche of service that we provide, and understanding that it's part of a bigger set of services being delivered across Liverpool, and not competing and not fighting, working together and bringing the because of our reputation, I guess we've been able to bring this resource to Liverpool, much like sort of 3 years ago. We were able to bring James's Place to Liverpool, and it's a different way of thinking and working about how we get things to happen in Liverpool. We bring them here, or we do them ourselves, and that this is another example of us being able to bring something to Liverpool, I think.
In terms of the number of people who come through the doors of James's Place, you've just hit a landmark amount. Yeah,
so we've had it's sort of a strange landmark to celebrate, really, because the people who come to see us are in distress, but we offered our 100th welcome assessment today, which is amazing to think that since literally in 6 months we've had 100, which when we started that we've sort of exceeded what we thought we would find. But and some really interesting sort of evaluation results, which are all stats and moving people from this level to this level. But when we've done a couple of national presentations, sort of academic presentations, and getting some very positive feedback. We think that we're doing well, and other people are saying, "Oh, actually, you are doing really well."
Jane, I wanted to ask you about that because when you've been on the programme, you came and you talk about the number of people you do it. You're seeing through who are coming through the doors. You're launching the new service. Last time you were on, you were talking about the way that you're able to help people and how you've seen something over sort of a short-term benefit over that 6-month period of time. But obviously, we have this thing where you're up the road, we see each other all the time. It appears you're doing brilliant work. But what is that response like nationally? Because I sometimes think in Liverpool or Merseyside, we're in a bit of a mental health bubble, in that it feels like there's loads of stuff going on here. There feels like there's loads of different services.
When you talk to people in other areas, there certainly is. And when you look at things like national statistics around sort of deaths by suicide, around sort of waiting times and things like that, what is, I think, services that are provided in Liverpool are good, and that was part of the reason why James's Place came here. If you're going to provide something that's very niche and innovative, you don't want to be having to work with other services that aren't very good. It makes sense, doesn't it? You wouldn't bring Mo Salah into a rubbish football team, just like you wouldn't bring James's Place into a rubbish health environment. That's my football metaphor for the day.
You've been hanging around with football fans
much too much. So when we presented it at the National Suicide Prevention Alliance conference recently and got very positive feedback from other organisations who were, one, quite surprised about the number of men who come through. So there was a comparative organisation that over 18 months had pretty much the same number of people that we've had in 6 months. And then the changes that we're evidencing with using our outcome measures, which is sort of like a psychological evaluation tool that people are administered sort of before and after the intervention. We're seeing, on a scale of 1 to 120, we're moving people down nearly 40 points on that. So we're taking people from when they're coming in with sort of moderate to severe symptoms of mental distress or psychological distress, and we're taking them down to where they're expressing mild and sometimes to what is coming out as a healthy range in terms of sort of mental health, which is quite amazing, really, that's happening.
But I was going to say that the reason, although it's mental health and suicide prevention, such important work, the reason we're being positive about it is because we're talking about saving lives, aren't we? We're talking about interventions which genuinely make a difference, and actually interventions which, if they weren't there, might actually end in someone deciding to take their own life.
The feedback from men who've used our service is that that's what's happened for them, is that they feel that without us they would have ended their lives. And then I guess as well as that, 2-3 of the guys that have come through our service have come to us at a point of a suicidal crisis and left in new jobs. We were unable to support them in their recovery enough that they could actually get a job at the end of it. Which I worked for quite a long time in mental health and I wasn't seeing those sort of outcomes. And I think there is something about that we're really hitting people at that point of crisis, that we're seeing the right people. So the underlying cause of their crisis isn't a severe and enduring mental health problem. There's the whole of Merseycare services to help with that. The underlying causes of their crisis are generally very solvable situations. We're just helping them to see that and to work through that problem and get their life back really quickly without it becoming a sort of a longer term problem. And I think that's what's the difference.
What's next?
Well, continue doing what we're doing. We're in the process of recruiting. We want to sort of, with these posters going up and sort of we're starting to publicise more and more what we're doing. We're getting to the stage where we're going to probably be back in a couple of months talking about how to come through to us in terms of self-referrals. And then the next, we'll be looking at where the next James's Place is. We'll have like a full year's worth of data in 6 months' time to go to other organisations and other places and say, well, why would you not want a James's Place in your city?
I like the fact that you're so comfortable here that you're already booking yourself in. We'll be back in a few months' time. Producer John's going, I'm in charge of the diary. It's the one thing he's got. It's the one thing.
He's fine.
Get her booked in.
Well,
It's brilliant work. Again, if people want to... can I share, obviously, James's Place, people associate it with it being in Liverpool, but obviously people will see about this on social media and things like that. If people are from outside the area, if they're texting JP to 85258, they're not going to get a knockback or locational block, are they? No. It's not a location based. All the JP means that we can track that people are coming through to this crisis text line, having sort of found out about it via us. That's the way. There are other routes in. The number is always the 85258, but it's if you put JP in front of it, people know that you've come from us. But yeah, you can. I presume you could call this from anywhere in the UK. Well, you can call it from anywhere in the UK. If you want to get involved in this new service from James's Place, running through crisis text line, just text JP to 85258 or make a note of it and pass it on to somebody else, or just keep a note of it about you just in case you ever need to use that service. Text JP to 85258, that new crisis text line service running through James's Place. Jane, always a pleasure. Thank you for your time.
Thank you very much.
Great to see you, and we'll see you again very soon. So a slightly extended mental health extra this week. Podcast listeners, you've just been listening to Jane Boland from James's Place and their new text service as well. In the studio live now, Jake Mills is with us from Chasing the Stigma. Jake, great to see you. How are you?
I'm very well. How are you? I like that you said, we've got a weather forecast. Where's that? And then you'd like sat in front of the biggest window to the city. You could just do a live one, couldn't you?
Yeah, but the key word is forecast, isn't it? It's not just like...
But also you can see out to Dublin.
Yeah, true. If the weather all came in this way, but it's coming in across Anglesey, and I can't see out that way. That's the way
Fair
it's
enough.
coming.
I just wanted to just make a little sarky comment to start with.
Because, well, anyone can just look out the window and go, oh, what are you bothering with the weather for? I'll just have a look myself. To be fair, that's what most people do there. Do I need a brolly? I don't know. Is it raining? Yes, I need a brolly then.
It's a good start to the show.
Jake, it's great to see you. Hey, I've got an invite to a fancy do that you're involved in. Everton Football Club have got one of their. They've got a gala dinner coming up next week. I don't know if this is public knowledge yet, but I'm going to make it public now by saying that I've got an invite. Yeah, no, it is public knowledge. So it's a gala dinner to raise money for the People's Place. I think it says it all really. That it's from the beginning, it's always had the buy-in from everyone at the club. But this gala dinner will have the first team players there, will have the manager there, and it's just to try and raise money, raise awareness of what we're trying to do with the People's Place, which is a brand new purpose-built mental health facility in the shadows of Goodison Park, which will be the first of its kind anywhere in the world for a football club to be doing this and to be trying to look at preventative ways of being able to help the community is massive. So it's been hosted, the event down at the Titanic, by Marco Silva, and you're one of the partners. Is there a danger you might get hooked after 60 minutes for Ademola Lookman?
Yeah, not the other way around, it's funny, isn't it? Because this is, ever since we started working alongside Everton, really, it's always been really strange for me as an Evertonian to be sharing a platform with the people who I shout abuse at week in, week out. So it's been quite nervous every time that I'm meeting anyone, just in case they remember me. But it's it's a great thing that the club are doing, and I think doing something like this, I think it'd be very easy to just be raising money and to just be putting buckets out every week. But what they're trying to do is show that there's a real engagement. Not to mention the fact that they committed to doing our Chasing the Stigma, or Ambassadors of Hope mental health training, where they've made a commitment to having every single member of staff trained, which is just over 500 members of staff. Again, starting with the board, starting with the chief executive, the first team manager, the first team captain, the director of football. I'm rolling that out right across the whole club. So they are serious about this, and I think you look at the history that Everton have got in the work that they do for the community. And actually, it's probably no surprise to many people in the city that Everton are the ones who would be the first to do this. So that event next Tuesday, I'm going to take my recording kit down there. So although you're working, you're working, I'm also working as well. And then what we'll do, we'll work that into a future edition of the programme as well, so people can hear exactly what's going on. And no one can have a go at you because you're working. Also, I've been offered an interview with you. Yeah, well, you're welcome. So I'll see if you're available on the night, yeah? Yeah, well, we'll see what goes on from there. Yeah, go through the media team, if you will. This week's Mental Health Monday podcast available to download with Dr. Suzi Gage. Suzi knows her stuff. She certainly does. And when it comes to data as well, very impressive recall of everything that she's been working on. She's been working on this study which looks at mental health of young people and a cohort 10 years apart, 2015 to 2005, and yes, depressive symptoms are more prominent, significantly more prominent in this generation. We don't know the reasons why, but we could also see obesity also on the rise, less sleep for young people as well now. So more research to be done in that field, but we can see that things are going in a certain way. We know about the prevalence as well of mental health issues in people at the age of 14, if they're not dealt with, how they can pass on to you when you're the age of 25 and then beyond as well. So it struck me that there was really loads of vital information contained with that report. Yeah, and it's something that can only be expanded on and continue to grow really as a report, and that the data is in many ways never ending really. But I think we've had these conversations over and over again, and particularly when we had the Lost Childhoods episode as well, is that it's so important now. But what we have to remember is that support has to match this awareness raising and these reports like this, and there has to be those support networks from NHS providers, but giving money to third sector as well to make sure that not only are we just highlighting awareness or, you know, how many problems or how many people may suffer and how normal it is and talking about it, but that the support is there, because that's what's lacking. So it's all well and good kind of government saying about being aware of the kind of the facts, but having that real funded structure of support is actually what is letting people down at the moment.
That podcast available to listen to, Dr. Suzi Gage, who's a brilliant advocate of 1,000,001 academic things as well. Great value. She does her own podcast as well, looking at the use of illicit drugs or drugs in general. And then that's quite an interesting, eye-opening thing that she does too. The links with mental health too. Can I give you some quotes from Prince William?
Yeah.
He's been talking about football and football's dereliction of duty when it comes to professionals and mental health. Some of these clubs don't do anything about mental health. They pick a player, he plays football, no good, move on. If we've got to change anything, we've got to change the whole way we look after players. Many players come from difficult backgrounds and we have all sorts of issues going on. He added that clubs are often guilty of treating players as little more than financial assets, with young players not given the key building blocks or support. This is a guy who's going to be the king, but at the same time, he's also the president of the FA as well. So somebody who might actually have a little bit of power to do something about it. Are we setting up some of our children at the moment for more mental health issues in the future by the way we're creating a win-win situation and scenarios? Because resilience has to be built within everybody from a very, very young age. He said nobody wants to be told they're not good at something. But of course, that could prove a difficult situation to handle when life comes along with schools and jobs and so on. How do they learn to pick themselves back up again? When they lose a match, you're gutted, but that's part of what sport is all about. Every sportsman and woman knows what it takes to be at the top of their game.
A couple of things on this really. First of all, totally agree with the comments he's saying. I think if we're going to look at professional footballers for a moment, and we're looking at kids who are trying to be professional footballers, they commit an awful lot to becoming a professional footballer. And if they don't make it for whatever reason, that's really, really difficult for them to kind of have to deal with, as well as all the things that they might have sacrificed in terms of education and everything. That's really difficult. If we're talking about a professional football in general, who are retiring at 38, 40, not to mention all the pressure that they're under. They might get a career ending injury as they've just started. So there's a lot of things that come with that. But what I will say is, particularly recently, we've had quite a few conversations with the Premier League and with a charity called Sport and Chance, who's Tony Adams formed and founded that charity. And they are aware of it. They are aware of it, and they are trying to do something about that. I can personally vouch for that side of things. I'm working alongside one of our trustees as well, and somebody you've had on the show, Professor Andy Smith from Edgehill University. Edgehill University have led on a survey where they have gone out to professional sports people to gauge the actual, the feelings of those, whether there is support, whether they are getting that support, and whether anyone has struggled. And the result of that are due out in April. And I think that's going to tell a big picture as well. So again, it's about finding out the actual, the reality of it, but then doing something about it. But I definitely think there's an appetite there now to actually try and do something.
I'm going to drop this is a dreadful name to drop, but this is a story about a conversation I had with a footballer. But I was talking to Holmes Under the Hammer's Dion Dublin, and I was talking to him about that sort of cliff that you fall off when you stop being a professional footballer. And he said, you know what? He said 2 or 3 years before my retirement, I kind of thought, I'm 2 or 3 years away from retirement here. So what am I going to do? I'm going to line up a couple of business interests. He got into the property kind of thing, got into the media. And now when you see Dion Dublin, you don't think, oh, there's that guy who used to play football. You think, there's the guy from
the Dube.
Holmes Under the Hammer. He invented a musical instrument. And also he's a pundit on TV. But I think there must be so many players who are just seen as that bloke who used to be a footballer. Like that their career for whatever reason, and some of them financially are fine, but actually it's like, but what are you going to do for the next 30 or 40 years? How are you going to engage your everyday life? And then you imagine the kids who are like 16, 17, 18, who got to that point where they were about to be footballers, and then for some reason, not good enough, not deemed good enough, dropped for whatever reason, picked up an injury. They've got that whole thing to go through, but they never had the career and they never got the chance to earn the money in the first place. But they got that same thing where they go, well, this is all I know. This is all I've done. And you're just creating cliffs and cliff edges, metaphorical ones, for those young people to suddenly go, well, what do I do now? What's life hold for me? Because everything I was planned for, everything I was building towards is gone, is forgotten. Even if you've had a great career, you're 35 and it's done.
Yeah.
That way, if I was a professional footballer, I'd be finished now.
Yeah, and that's the problem, is that you're not even halfway through your life, and you've got nothing to kind of generally, or you might not know what your aim is, what your next thing is. With Dion Dublin and the example that you're using there, I would probably argue is in the minority in planning ahead, thinking ahead. I was listening to another podcast recently where Gary Lineker was talking about when he was at retirement age as a footballer, that you were able to draw on your pension at that age. Obviously, it's not about finance now, and I think people really kind of quite quickly and easily use the rich and fortunes of somebody to say, well, they're all right, but all the money in the world, you'd soon be bored if you had nothing to be kind of aiming for. Not everybody wants to be a coach. Not everybody wants to be a manager. Not everybody wants to even remain in sport. So that, and again, that's what the Premier League kind of in our conversations was saying, is that they don't want to wait until that stage when you are retired before you start thinking about this thing.
Yeah, and of course, it's not just sports people. A new study out from the Guardian reported a poll today. Almost 38,000 UK students were involved in a poll suggesting rates of psychological distress and illness are on the rise in universities, with alarmingly high levels of anxiety, loneliness, substance misuse and thoughts of self-harm. Researchers say the report is the largest mental health survey ever conducted among UK university students, and its findings constitute an urgent call to action. I don't know about you, but I've seen sort of varying different reports about crisis or lack thereof within the student population. I think because they're quite a specific population, any figures around them might look heightened or not when you then compare it to similar people of their same ages. Half of students who took part reported thoughts of self-harm. That's half, 50%. That's a lot. That's absolutely significant. Almost twice as high as reported rates in 2017, while just under 1 in 10 thought of self-harm often or always. More than 4 in 10 admitted using alcohol or drugs to cope with their problems. 1 in 10 said they did this often or always. 1 in 3 had experienced a serious psychological issue for which they felt they needed professional help, an increase of just under 1% in a year. Every single one of those stats is pretty awful, isn't it?
Yeah. Did you say 4 in 10 use drugs and alcohol?
4 in 10 admitted using alcohol or drugs to cope with their problems.
Yeah.
1 in 10 said they did this always or often.
And the thing with, they use the word admit there. The thing with these type of surveys and stuff as well is that people might not even associate the way that they kind of behave or drink or deal with issues as a coping mechanism. So it arguably could even be higher than that as well.
Students reported high levels of anxiety, 42.8% often or always worried. 9 in 10 said they struggle with feelings of anxiety, an increase of 18%. And a third reported suffering from loneliness often or all the time. 1 in 5 said they had a current mental health diagnosis, most commonly depression and anxiety disorders. So actually that's quite a significant number who are already diagnosed. If you've got 1 in 5, that's a significant number. Often we talk about the numbers around that as well, but actually to be diagnosed 1 in 5 suggests that at least there is a movement there within that student population to get a diagnosis or seek a diagnosis maybe? Yeah.
Did it say diagnose? Because it'd be interesting to know whether they're diagnosing themselves or being medically diagnosed, but that in itself is quite interesting as well, if even if it was a self-diagnosis, to be aware of that, because as we've discussed before, that's often the hardest thing, is actually being aware of it, knowing what it is, and and you need to be able to be aware of it before you actually seek help.
Dr. Stephen Pereira of Insight Network, counter to popular belief, it isn't the initial transition from school to university that seems to be the most associated with psychological difficulties. The research showed that students who are navigating the transition into their second and third year report the highest rates of anxiety, loneliness, substance misuse, and thoughts of self-harm. More research is needed to understand the specific rise and protection factors at play during different years of university in order to support services to effectively meet these year-specific demands.
Yeah, I think you look at the statistics around dropping out after the first year, and that would probably align itself with that as well.
That's the first time I've ever seen a mental health story and thought that I might actually be a case study myself.
Yeah.
And that was my experience completely. Second, third year into leaving. First year was absolutely fine. I had a bedroom to myself for the first time ever. That was great. When I first year at university, I was like, happy days.
Yeah.
Yeah. Even 2.5 years with the university for me, absolutely fine. That last bit. Last bit was an absolute... First year, nothing but happy memories in that. But
then it's a transitioning into the away from school type and university into the real world as well, and that's hard. That was hard for me.
Oh yeah. Long after that as well. But yeah, it was just the starting point where where life dawns on you.
Yeah,
it's a frightening time. It's that thing, the old adage of, they say it's difficult going into puberty. It's even more difficult coming out the other side.
Yeah.
But there you go. That's a report which is in The Guardian. You can check that out, Guardian online. Just type in mental health into The Guardian search. You'll get all the information. But that's coming out of students and that new survey, 38,000 students. What's going on at Chasing the Stigma this week, Jake? Apart from your big do at Everton next Tuesday?
Yeah, we've just been in with, we just visited Jackie Daw-Price, Suicide Prevention Minister in Parliament as well. Discussed the Hub of Hope and the importance of the third sector and how we can be looking at a new approach. And yeah, we've just got a lot going on really, but it's all good with more stuff to announce soon.
Any other ministers that you met this week that you were just holding back on and just announced right at the end?
I did, yeah. No, that's all right.
Yeah, bump into Chris Grayling on the train now.
Yeah, in Greg's, actually, yeah. I found him.
Jake Mills from Chasing the Stigma at hubofhope.co.uk. That's hubofhope.co.uk if you want to find mental health services close to where you are. And Jake Mills joins us for Mental Health Extra.
Mental Health Monday with Mick Coyle.
On Radio City Talk.